Hello YouTube, it's a fellow gamer regarding or should we say the average non-popular and average human gamer videos around here is just truly. Oh yeah, do you know that I can't talk that much and I'm not talking because I was sore throat and also won't be talking that much so if you find injury that require I just notify in the description for those who can't hear cause of my microphone. Oh yeah, it is if you are very squeamish about blood and other things, just don't watch our video or you just take it. Trust me. Okay, start this. Okay. No. Sorry. Okay.
Hello, and welcome to Surgery Squad's virtual adenoidectomy. I'm Dr. Susie, and I'll be guiding you through this procedure today. Our adenoids are located at the back of the throat, just below where the nose connects, also known as the pharyngeal tonsil. They are part of our immune system because they protect us from the bacteria or viruses that might enter the body when we breathe or swallow. They are more important for children than adults, and they shrink as we get older. In some adults, they become inflamed, which can lead to infections, sleep apnea, better known as snoring, and ear infections, since enlarged adenoids might block the eustachian tubes, which drain fluid from the ears into the throat. Normally, these symptoms can be treated with antibiotics, but when these infections occur more frequently, we perform an adenoidectomy to remove them. Having an adenoidectomy, if it is required, can reduce the number of ear infections, reduce recurring chances of sinusitis, and can alleviate sleep apnea. However, there's a risk of developing an infection at the removal site. Plus, the procedure might not alleviate all the problems associated with adenoids. For instance, if ear infections continue, the problem might be elsewhere. Our patient today experiences sleep apnea and ear infections. Let's scrub in and get to work. We'll need to use a general anesthetic for our patient. Why don't you help out? Can you find a suitable vein in the patient's hand? Looks good to me. Sterilize the injection area using a sterile alcohol wipe.
I can't record that much because I keep on recording and then I realize I can't even record.
Insert the needle and advance the angiocatheter into the vein. The small burst of blood in the angiocatheter hub is what medical professionals refer to as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. While placing a small amount of pressure over the vein to collapse it, remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed. Now that the needle has been removed, I'll dispose of it in a sharps container. We need to secure the IV with tape and test the line. Great! Now we'll wait a few minutes for the anesthetic to take effect. One more thing, since we'll be working in the patient's nose and mouth area, we'll need to make sure he can breathe. Let's insert a breathing tube into one nostril.
Check here.
Great job! Our patient is under and breathing. Now we're ready to remove the adenoids. We'll begin by putting an endoscope through our patient's nose so that we can view our work on a monitor. When we reach the back of the nose at the entrance to the throat, we'll be able to see the adenoids. Okay, good. Now we can see the adenoids. We need to open the mouth and get the tongue out of the way so we can begin our procedure. To do that, we'll use a special retractor that opens the mouth, depresses the tongue, and locks into position.
Okay, what the hell is that retractor? Looks quite big for a retractor. Check that here.
Great work! We're going to remove the adenoids using a device that uses suction cautery. The device uses electrical pulses to liquefy the adenoid, then suctions the liquefied adenoid out. This method...
Let's see. He's staying forever. Okay. Okay, check one more time. Okay, sorry. I'm checking their own because it can cost
Fantastic! The adenoids are gone. Now all we have to do is remove all of our equipment and get our patient to recovery. Our patient is in recovery, and he'll be able to go home in a few hours once he can breathe easily, cough, and swallow. We'll prescribe some antibiotics, and once he gets home, he needs to drink plenty of water to keep hydrated. He'll also need to stay away from solid foods, but he'll get to eat ice cream, sherbet, popsicles, and jello for a couple of days.
Lucky.
He might experience a burned taste in his mouth, which will subside after a couple of days. He should brush his teeth often to help alleviate that taste. Scabs might form in the back of his throat from the surgery. And, of course, he should contact his doctor if there's bleeding or excessive pain from where the adenoids were removed. You did a great job today. Try your hand at one of our other surgeries here at surgerysquad.com.
Okay, let's try another one. The retinal, let's try laser eye surgery, or whatever it's called, LASIK eye surgery, blah blah blah. Okay. Blah. Is this? Then taking this, blah blah blah. Yeah, you got bun, shabamana, okay. La la ma da da ma.
Welcome to Surgery Squad's virtual LASIK eye surgery.
What is a LASIK?
I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today. LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses. LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes? Even with the numbing drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate the procedure, so we need to make sure that the area around the eye is clean. Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide. So let's get that speculum over the eye.
Open eye.
If the patient was allowed to blink, we might cut or burn the wrong area.
Ouch.
At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction ring over the eye. The ring sucks the cornea upward, making it easier to cut. The patient's vision will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring. We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea. With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea. This is the part we'll reshape with a laser. The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds. The laser makes a slight clicking sound and you might notice a faint smell similar of burning hair. And that's it. Please fold the corneal flap back into the original position, making sure our ink guides match up. Nicely done. While you were working, I went ahead and took care of the other eye. We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye. This keeps the patient from bumping or rubbing her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery. You can see more of my superior surgical technique and my other procedures here on surgerysquad.com.
Okay, let's try one more. It's called tonsillectomy. Okay, going down. And let's press here. Cut.
Welcome to Surgery Squad's virtual tonsillectomy surgery. I'm Dr. Jeff. Today we'll be removing a young man's tonsils. This is a common operation that's performed when a patient suffers from frequent bouts of tonsillitis. It's most often performed on younger patients, but adults can need it as well. The tonsils are located at the back of your throat on either side of the uvula. That's the little punching bag thingy that hangs down in the middle. Tonsils are infection fighters, but occasionally they lose the fight and get infected themselves. They become red and enlarged and can sometimes make it hard to breathe and swallow. Normally we treat this with antibiotics, but when tonsillitis reoccurs frequently, we remove them because the infection can cause more serious damage. Our patient was given a sedative before being brought into the operating room, and the anesthesiologist will help put him completely under. Help me out and place a breathing tube in our patient's nose to assist with breathing while we operate.
Okay.
We need to get our patient's mouth open wide so we have room to work. To do that, we'll use a special mouth gag retractor that opens the mouth, depresses the tongue, and locks into position. Why don't you take a crack at that? Great job. That should give us plenty of room. Now we have to reach in and grab the infected tonsil with the tonsil forceps. We need to pull it to the side to expose the connective tissue. Can you do that for me?
I'm lazy.
Nicely done. With the tonsil extended out, we need to place this electrocautery device at the tonsil's base. The device uses high-frequency current to cut away tissue and seal off the blood vessels at the same time. By removing the tonsils this way, we reduce bleeding and allow the patient to heal faster. Now that the tonsil has been cauterized, we reach in with a tonsil guillotine clamp. The clamp severs the last of the connective tissue and allows us to remove the tonsil from the throat. Clamp the tonsil and pull it out, would you?
Have a load of this.
We'll bring the electrocautery device back in here and apply it to any bleeding areas. Because this part of the throat heals quickly, we won't need any stitches. Now we repeat our steps on the other side of the throat. Extend the other tonsil with the tonsil force. Just like the other side, we'll cauterize this and finally we need to remove the tonsil. And don't forget those bleeders.
Okay, thanks.
I'll clean out the mouth with some irrigation and suction, and then we're all done. We'll send our patient to recovery for 8 to 10 hours, and more than likely he'll be able to go home later today. Once he's sent home, our patient will be put on a course of antibiotics. He'll need to keep hydrated with cold water or sports drinks. And if he gets hungry, he can have cool, soft foods like fruit pops, gelatin, sherbet, pudding, and, of course, ice cream. Getting a little hungry?
No.
Thanks for stopping by surgerysquad.com. While you're here, check out some of my other spectacular surgeries. They'll always stand the test of time, unlike my hairline.
Okay guys, I think I'm done already. So if you guys just give me one like, just this one like, I may do a double upload. I'll definitely do that. Yeah, just the only one like. Okay, if you like this video, or sorry I got a bit angry, just got frustrated because every time I stop recording, but every time I doubt whenever I start recording, the thing will start recording, so I'm sorry about that. And yes, yeah, I'm done here. Okay guys, if you like this surgery video, hope to leave a like, subscribe, or you can comment if you want to. And okay, I'm done with this video, and see ya, bye.